Right, so today every man wants a perfect chest. But even if you go to the gym every day, sometimes it simply doesn't work. So that's why you need some pectoral implants. So how does that work? It's performed under general anesthetic. It's a 1-hour surgery. The incisions are 5 centimeters long, and they are located in 90% of the cases in the armpit. In 10% of the cases, they are in the inframammary crease, and we use them for specific reasons. The implants that we're using are specific implants. They're made in cohesive silicone. They have the shape of the muscle, and they come in 2 or 4 different sizes. There are 4 types of patients that I see in my consultation who require pectoral implants. Originally, this operation was only made for people who were born with a difference between the 2 sides or had some kind of injuries making a difference between the 2 sides of their chests. Then in 1990, an American surgeon started to use pectoral implants on both sides for bodybuilders, but he was using hard silicone implants. Personally, in my experience, I started to see a patient who couldn't build up any muscle, even if they're trying very hard. And that's how actually I started using a specific implant. It has, as you know, about 3 different types and 3 different sizes. And the last category of patients is a patient who had extensive surgery, maybe too aggressive, like liposuction, for instance, and they have a need for reconstruction of the chest, and that's why we use the pectoral implants. So the increase that you can get with pectoral implants, of course, depends on what size of implants you have, but it starts from 2.4 centimeters to 2.9 centimeters. Now you have to keep in mind that we're putting an implant under a muscle which has already a certain thickness, and you want a natural result. You don't want the chest to look too feminine. And also, you have to keep in mind that this new chest size has to match with the arms. In other words, you don't want to have the biceps too small compared to the chest. So that's why we have only 3 different sizes, but they actually they are the good answer to what all these patients need. Pectoral implants have potential risks. Because they are implants, they have a life expectancy, first of all. We're not really sure about this, but in theory, they have a 10 years expectancy life. They are also painful for about 3 weeks. There's always a risk of infection, so the patient needs to take antibiotics. And you want to rest for the first 3 weeks, otherwise there's always a risk of displacement of your implant. And finally, just like with any type of implants on the body, there's a risk of hardening of the tissue around the implant, what we call a capsule contracture. But the risk here is quite small. Well, if you gain weight after having pectoral implants, it is always possible to remove this excessive fat with a liposuction. But first of all, I would say that people who want to have this male chest reshaping with pectoral implants, they know that they have to be careful with what they're eating and go to the gym, at least in a reasonable way. But I would say that pectoral implants alone used to be what I was doing most of the time for the first 20 years. But recently I decided to combine this operation with a vaso liposuction to the chest, which actually will be done before inserting the implants. And the purpose of this vasoliposuction will be actually to remove all the different excess of fat that can be around the pectoral muscle. So combined together, these 2 techniques will give you the perfect shape, and I now recommend all my patients to have it.